Stefan Hartman here, Iron Direct Primary Care. I'm at Amex Pharmacy here with Dr. Mike Bohmer.
Hello.
Mike here is going to talk to us about methylene blue, an interesting little molecule that not many people know about. So Mike, I used this in chemistry class and biology class. We used it to stain cells to take a look at it. But how does this apply to therapeutic uses?
Yeah, very interesting. Methylene Blue is an FDA-approved drug that's been around probably, it was around long before it was an FDA-approved drug. I believe it's around 140 years and it's been around. And it's been repurposed many times throughout the time that people have been using it as both a medicine and in commercial use, as a dye. The main medical use for many years has been in pathology because methylene blue is a blue dye and it selectively will go into sick or inflamed or diseased cells. And it will make them stain a darker blue so that a pathologist or somebody trying to understand what's going on using a microscope and tissue samples and all that, they can start to understand maybe where the disease is working and all this. So it's been used in medical research and things for years. But it really has some other interesting properties. And the main one we're discovering is that it's a redox buffer that has a lot to do with enhancement of mitochondrial function. And as you know, in functional medicine, if your patients are interested in functional medicine and learning about longevity and lifespan and what makes a healthy person functioning well on a proper genome without a lot of trash in their exposome and all that, you can use methylene blue. You can use other mitochondrial enhancers like NAD, NAD+. You can use methylene blue. You can use glutathione, things like vitamin C. These are all antioxidant type of molecules, and they improve mitochondrial functioning. At the end of the day, they reduce chronic inflammation signaling in your body that is the root of many diseases.
It's very interesting. So I've been using a lot of those, glutathione, NAD, and vitamin C, in a lot of my treatment protocols for COVID and other items. How would methylene blue add on to that? That's
a great example. Taking those things individually, when we look at mitochondrial function, that's one of the main problems in all disease, really. Because let's talk a bit about what a mitochondria is for your audience. If you're not familiar with that, the mitochondria is like the battery power or the energy source in every cell of your body, pretty much. There's almost no cells in your body that don't have a mitochondria. Most have hundreds, and they produce ATP, which is what the energy source that your body uses. So when you're giving patients things like vitamin C, glutathione, N-acetylcysteine, NAD, or methylene blue, they're all mitochondrial enhancers that work on different parts of the mitochondria and its electrochemical biology. So they're all tools that you're already using to manage illness from that perspective, which is very good. That's kind of the cutting edge of what I guess we could call primary care medicine really should be doing.
Yeah.
Primary care medicine, they're not looking at your mitochondrial function, but that controls things like heart disease, dementia, many of these neurodegenerative diseases, many cancers. Really, most chronic diseases are shaped by and come from oxidative stress overwhelming the body's defenses against it. And so by using these medicines that you're talking about, which really are nutritional supplements, and when we talk about food as medicine, that's what we're talking about here, because they're super important. But you can't really get these things in your diet per se. And chronic inflammation and aging in your body already, and toxins and things of that nature that are already impairing your mitochondrial function, they also start to shut down the enzymes that operate the mitochondria. So even by giving supplements, you can't always restart the mitochondria because it would be like the equivalent of having lots of gas in the car, but the engine won't start.
That's what you alluded to earlier when you talked to me earlier, is methylene blue helps these other nutraceuticals?
It does. Well, methylene blue is a little different than, and again, we're really talking about, and I'm sorry if we're getting too technical here for the audience, but what we're talking about here is the electron transport chain inside the mitochondria, which is how the mitochondria actually produces ATP that your body runs on most efficiently. So when you talk about NAD, you're looking at one thing that helps mitochondrial function, because if you put NAD plus into the system, that's one job that the mitochondria doesn't have to do. You fed it a raw material that it needs. Same thing with when you feed the body N-acetylcysteine. That feeds glutathione production, right? But we know that not all people can make enough of their own glutathione. Why is that? That's because the enzymes that do so have been shut down by excessive oxidative stress. So interestingly, oxidative stress, the answer to it is to neutralize the oxidative stress, but the oxidative stress itself is shutting off the enzymes that produce the chemicals that neutralize it, interestingly. So that's why we have to have a functional medicine doctor rather than managing these conditions yourself, because a patient can't read, and then without medical testing and without a good knowledge of what these things are doing, you can't really do this yourself as a nutritional supplement package. This gets into the realm of what an anti-aging medicine doctor or somebody knowledgeable about all these things really needs to intervene and be your partner in this. So they are nutritional supplements in many ways, but I don't know that they're within the scope of a patient to know how much to take, which one to take, what combinations of them to use to suit their current condition and their goals, their treatment goals.
Cool. And how would I use methylene blue in clinical practice? So,
methylene blue, again, is an FDA-approved product, and it's classified as a redox buffer. So if you think about ATP in your body produced by your mitochondria, if you think of that as energy, like money, like a dollar, like money. And then if you think of oxidative stress, like you might think of debt, right? So oxidative stress is like you owing money to somebody else. You spent that money on something, and now you owe it, and you have to pay it, right? In biology, it's a zero-sum game. The bill will get paid. So by adding methylene blue to somebody's regimen, when you're using things like NAD, glutathione, NAC, CoQ10, when you're using these things and you add methylene blue to that, it's like adding a credit card to the account. Okay, so if the body can't pay, the methylene blue account can kind of pay and buffer the need for that. Now, what it's really doing is it's absorbing or donating electrons into the electron transport chain as needed at that moment, at that very second. It's an ongoing thing, never stops. It's like an immediate ongoing thing. And if you don't do that and you don't buffer their redox, then you're going to be signaling for pro-inflammatory cytokines. You're going to be signaling for NF-kappa B to produce all these different pro-inflammatory cytokines. So you're going to have things like TNF alpha. You're going to have things like interleukin 6, interleukin 17. You're going to see those kinds of characters signaling that cell's in trouble.
Yeah.
And so we're basically preventing that unfavorable signaling by using methylene blue as a buffer.
That's cool. And you compound this here?
We do, yes. And the commercial product that's available as an FDA-approved product is for a very rare blood poisoning, I guess you could call it. It's called methemoglobinemia, and it's when a person's been poisoned and their hemoglobin in their blood can no longer carry oxygen and they're dying. They give them methylene blue to correct that, because again, it's kind of buffering that oxidative reductive reaction and allowing their hemoglobin to function again. But the dosages for that acute, tragic illness,
cyanide, right?
Yeah, cyanide poisoning or something similar. So lead and any of the heavy metal poisoning, or other mycotoxins. So, but all that being said, if the dosage of methylene blue for that kind of crucial condition is very, very high. So that's not what we do on a daily basis. That's what you could give a patient, like 1 dose, 2 dose, 3 dose, to get them out of a crisis. But on a daily basis, we recommend 5 to 10 milligrams twice a day. So it's 10 to 20 milligrams daily, which is about 1/10 of the normal or what we might call a maximum therapeutic dose, because I think we would say that when a person's life's at stake with methemoglobinemia, we want to use the maximum dose, right? We're trying to get that taken care of quick. So, but at 1/10 of that dosage, we found that it's very safe. People don't have any problems using it. And I think, the other thing is, you'll probably see some cognitive enhancement, because methylene blue also is a MAO inhibitor to some extent. So by inhibiting monoamine oxidase, we're going to improve people's dopamine, we're going to improve people's serotonin. Now if that goes too far, again, that's dose dependent. So we're still at a very low dose, 1/10 of what we would consider a high dose. So people with antidepressants probably shouldn't take methylene blue without an evaluation by an expert in the area. Same thing with Ritalin, Adderall, those items, because they're metabolized by monoamine oxidase. So we're going to slow the metabolism of those medicines by giving methylene blue. So just something to keep in mind. It's not something we can't do, but it's something we have to be cautious with.
Cool. Excellent.
Yeah, it's a very beneficial chemical. It's a very powerful tool, and it's better at. It's not as strong as taking something like Dex or prednisone, but it doesn't suppress all of the immune system. It's only suppressing the pro-inflammatory cytokine signaling through NF-kappa B. So it's not directly stopping your immune system from functioning. So that's why a steroid is so great, but it's also why a steroid is so dangerous long term.
Yeah. Cool. Well, I think that was a great introduction to methylene blue. Thanks.
You're welcome. Thank you, Stefan.
All right.